Hello, this is Chapter 3 lecture video. Chapter 3 is Substance Misuse, Dependence in the Body. And we are going to break this down into two parts. The first part, we're going to cover what the drugs are and how they can be used. And then the second part will be the effects on the body. So the primary goals or objectives for this chapter are to discuss, the different types of drugs, the different categories of drugs, how you can consume these types of drugs, and what the effects are on the body. So those are the primary goals that you'll get out of this. Now, your textbook does give you a very good description of all the different drugs. There's a table in your textbook. However, just from years of working in the field, I have a very different way that I like to break down this chapter. So I'm not really going to follow along with the textbook as far as this lecture video goes. So this one will be very different than some of the other lecture videos that you've already watched. So the first part that I wanted to start with is, so we have drugs. So how do we do drugs? How do we consume drugs? Let's start with that. You have the drugs in front of you, and we want to know, how do we get it into your body? Well, that might sound like an obvious question with an obvious answer. However, there are some things that you may not have realized. So you can drink, you can consume alcohol, you can drink a beer, you can drink a glass of wine, you can drink a shot, you can drink those types of things. Primarily, alcohol is really the only type of drug that you can drink, or that it is common to drink. But some of these other ones have some other things that you may not have realized. The next would be swallow. So you could swallow a pill, you could swallow, an edible, a marijuana edible or something like that. You could swallow acid, you could swallow different things like that. You can chew on, a leaf, you could chew on a acid strip, you could, chew your drugs if you chose to do so. Smoke, you can smoke a cigarette, you can smoke, or otherwise known as freebase, you can freebase your heroin, you can even freebase alcohol. You can snort cocaine, you can snort heroin, you can snort pain pills, you can snort benzos, your Xanax, Klonopin, different things like that. And you can also inject. So you can use a needle to inject that directly into your vein. However, there are some drugs that if you do inject into your body, that there is a good chance that you could blow out your vein by doing such things like that. So all of these different types of ways that you can consume that into your body, have different effects based off of what drug you're using, what method to get into your body. But the primary goal of any of the above is that you're getting the drug into your bloodstream. So that's the end game. Once you get the drug into your bloodstream, it's carried by your blood into the brain, into your central nervous system, which is causing the release of neurotransmitters, which are the feel-good chemicals that make us feel good, the pleasure. So again, we'll kind of talk a little bit more about that at the end of this chapter, but I wanted to kind of bring that to your attention now before we start getting into the drugs. Drugs are metabolized into other chemicals and or expelled from the body as waste products. So we can detect them in our urine, failed drug tests, stuff like that. All right. In addition to affecting the central nervous system, the drugs can affect the rest of the body. So you can affect your heart, your liver, reproductive system, and or a developing fetus if you are female and pregnant. So if we're going to work with addicted people, we need to know how different drugs affect them, how they work, what they do. So that's kind of where we get into the first part of that chapter. So the first thing I would like to do is identify what is a drug. So we have this very broad category, it is a drug. I know a lot of us can assume what we think a drug is. We think a drug is alcohol, heroin, cocaine, crack, all of the above. To define that a little bit more, any substance that affects the physical or mental functioning of someone, including animals, as whatever a living organism is, especially if used for treatment or prevention of an illness or a disease. A substance that is taken for things other than treatment or prevention of an illness. So that is identifying what a drug is. Again, we know, generically speaking, that alcohol is a drug, marijuana is a drug, cocaine is a drug. Those are what we look at when we think of drugs. So a psychoactive drug is one that affects the central nervous system. So I'm going to identify all of these different types for you here in a moment. And the various reasons as to why we consume these drugs may vary. It could be for self-medicating purposes, it could be prescribed purposes, it could be for fun, for recreational use. Either way, you're consuming these and they are affecting your body. These drugs can be misused. And the reason why people misuse drugs is because they make us feel good. So those neurotransmitters that I mentioned a few moments ago are the feel good, the pleasure centers. So a lot of times when people misuse drugs or abuse drugs, they're abusing ones that make them feel good, or they enhance like that pleasure center for them, because why else would we continue to do drugs if we didn't feel good about them? So the drugs are allowing chemicals into our brain that kind of mimic what that feel-good neurotransmitter should be doing. So those are the drugs that people tend to kind of become dependent on or misuse a lot because they constantly want that feel-good feeling. Drugs can also alter our sensory perception. Different types of drugs will affect different types of parts of the body. So, different types of psychoactive drugs. These are our categories, our classifications. We have depressants. We have alcohol, barbiturates, tranquilizers, which would be like your benzodiazepines would be a minor tranquilizer, opiates, and anesthetics. We have stimulants. Oh, I'm sorry. Let me go back to depressants for 1 minute. So depressants are the drug category that's going to bring your body down. They slow down the central nervous system. They depress the central nervous system. At low doses of these medications, it's been known to reduce anxiety. And at high doses, it could induce anesthesia or, death would be at a high dose. Then we have stimulants. Our stimulants are our uppers. They're our feel good, make you fast kind of, if you drink a bunch of caffeine type uppers. So in that category, we have cocaine, amphetamines, nicotine, and methamphetamines. Next category would be hallucinogens. So these are the drugs that take you somewhere else. We have LSD, mescaline, and psilocybin, which would be your mushrooms. We're going to go back to depressants here in a moment because I want to kind of, go in and kind of actually identify a little bit more about these drugs. But there's a couple other things I want to touch upon first before we go there. Your book on pages 103 to 105 has a table 3.2, and this actually breaks down all of the drugs so you can visually kind of take a look at that. That's definitely something to take note of. Also, there is a PowerPoint in addition to this lecture video. This is the only chapter or only module that has a PowerPoint, so take a look at it. I kind of broke down a little bit about the drugs and how, what they are and what classification they have and stuff like that, so that if you are a visual learner, you can have something more visual that you could kind of take and look at versus just listening to on this lecture video, or maybe broken down a little bit different than how your textbook does. But in the textbook, it also gives you your chemical names, your street names, how it's taken, whether it's a DEA scheduled drug or not, and effects and side effects of the drug. So it's definitely a very good table to take a look at. And other drugs that are on this chart that's in your book would be cannabinoids, which is your marijuana, club drugs, MDMA, Rohypnol, GHB, dissociative drugs, which would be ketamine, PCP, salvia. We also have steroids, inhalants, I don't know why I can't pronounce that one, and other prescription medications. So like I said, we were going to go back to depressants for a minute. So let's start with alcohol. Alcohol is the biggest depressant that you can probably think of. It's the most common one that you're probably most familiar with because it's everywhere and it's legal. So alcohol is ethyl alcohol, ethanol. It's colorless, flammable, and volatile. And it's produced by fermentation. Its potency is increased through distillation. We learned a little bit about that back in the history chapter right before this, where that's kind of how alcohol was becoming more potent through the distillation process over the course of history. So the effects of alcohol, blood alcohol levels that rise typically allow a person to feel a buzzed feeling. So they're going to be talkative, they're going to be social, and when your blood alcohol level actually starts falling and you're going back down to like that sober level, you're going to be not as social, a little bit more withdrawn, depressed, probably less rational, things like that. At very high blood alcohol levels, you are going to feel sleepy unless you have a tolerance built up, and you could risk comatose or death, depending on how high your blood alcohol level is. Depending on a person's genetics and depending on a person's personality, they may feel different things when they consume alcohol. So a person may be aggressive, they may be loud, they may be quiet, they may be flirtatious, they may smile, they may know it all. Different types of personalities come out when they use alcohol. Some societal impacts of alcohol. Alcohol is associated with 23% of suicides, 16% of child abuse cases, 47% of homicides, 47% of young male car crashes, 50% of date rapes, 34% of drownings, and 42% of fire injuries. Some other correlations with alcohol. Physical health. Alcohol itself contributes to over 200 diseases and health conditions. Behavioral health. People in treatment may use alcohol, or it may cause people to be in treatment for behavioral health. The economic cost is $220 billion a year from alcohol alone. Most of the cost of substance use is from alcohol and tobacco and not illegal drugs. Other things with alcohol: not using safe sex precautions, risk of HIV/AIDS, other sexual diseases, sexual assault. For college students, deaths, injuries, and date rape. 15% of college women are raped during their first year while incapacitated from alcohol. So those are some of the different, negative things that could happen with alcohol. Oddly enough, there is some research that says that there are benefits of moderate drinking. So we're going to cover a little bit about that. Typically you think that, there's all these negative things to it, but there has research that shows that, drinking in moderation, maybe falling under that harm reduction model, that there are some benefits to it. One of them is preventing heart disease and stroke. Moderate drinkers live longer than abstainers and less prone to obesity. Moderate drinkers would classify as up to 2 drinks a day for men and 1 drink a day for women. So that would be considered a moderate drinker. It's true for diseases of middle age and beyond, so it doesn't apply to young people. So again, that drinking in moderation, applies more to middle-aged people, not young people. Properties of alcohol. Addictiveness. 7 to 10% of drinkers develop dependence. So it's stimulating the pleasure centers of the brain less than cocaine, heroin, amphetamines, and similar to cannabis, marijuana. But I wanted to kind of compare that. So 7 to 10% of people who drink alcohol are likely to become addicted or become dependent on it. But I want to put that number in comparison to some other drugs. So others who become addicted to heroin, injecting heroin, is 33%. Cocaine, 22%. Marijuana, 8%. Using meth a year after their first use, 5%. So there's not really a truly addictive side with using meth, but there is that 5% possibility. So I wanted you to kind of see where alcohol ranks in line with some of the other drugs that are commonly abused. It's not just alcoholics who drink excessively. There was a survey where 1/3 of adults in the United States drink excessively at times, but are not addicted to alcohol. There was a term that we used to use when people would have like a sometimer. So on birthdays, special holidays, different things like that, where people would just kind of go out and get drunk, but 99% of the time, other times they weren't drinking or they weren't drinking in excess. It was just on special occasions or holidays. Now, when that special occasion or holiday becomes something else, or it's becoming more often, then you're noticing that pattern there. However, textbook says, though, if you are using just on holidays or you're using just on special occasions, that's still considered a pattern, which would kind of classify you under being an addict. So just some food for thought with that one. Another term I want to throw at you guys is tolerance. Some have a high tolerance by nature and others develop tolerance as the central nervous system adapts to its effects and the liver gets more efficient at metabolizing it. So over the course of time, if you keep continuing to use, your tolerance is going to build up, whether that be for alcohol or other substances. There's also such thing as behavioral tolerance. You're learning to adapt one's behavior to the presence of the drug. So you may, for this, the best example I can give you is maybe you might be able to start hiding it a little bit more, or your behaviors aren't going to be as noticeable the more tolerance that you build up with it. People who have low sensitivity to a little alcohol are at higher risk of alcoholism. When you abstain from alcohol or drugs, your tolerance actually decreases. So you're not going to have that tolerance that you once had. There's also such thing as tolerance reversal, where you lose your tolerance. You can get drunk on your first drink, because liver is no longer efficient at metabolizing like it once was. And something else that could happen is cross tolerance. Tolerance developed for one drug but carries over into the drugs of the same class. Withdrawal. So let's talk a little bit about withdrawal symptoms. So withdrawal symptoms can be physical and emotional reactions after they have become dependent or addicted on a drug. The central nervous system gets hyperactive and produces the opposite effect for what withdrawal symptoms you're having for what drug you're using. Alcohol withdrawal. You might have seizures. They're rare, but they could happen. Tremors, nausea, vomiting, anxiety, depression, irritability, headache, insomnia, illusions, or hallucinations. Another thing I would like to mention about the alcohol withdrawal and also with benzodiazepine withdrawal, which are your Xanax or Klonopin, is that those two categories of drugs are actually ones that you can die from the withdrawal from. A lot of people think that you can die from opiate withdrawal or heroin withdrawal, which I'm sure there are cases that does happen, but you're more likely to die from heroin use or opiate use with an overdose rather than the withdrawal effects. Alcohol and benzodiazepines, because it's you've got that depressant category and you're slowing down that central nervous system, and that's where the withdrawal symptoms can affect the body differently. When people are withdrawing from heroin or other opiates, they're going to feel like they are dying. Again, this is not every case, but just kind of something I wanted to share with you guys. The withdrawal for crack or cocaine, it's a mild withdrawal symptom, but it could include depression and cravings. Your body may crash and you might feel like your whole world is upside down. The withdrawal from opiates, you're going to have diarrhea, chills, muscle aches, anything similar to what your flu-like symptoms would be. Those are going to be your withdrawal symptoms from heroin or from opiates. When you don't drink caffeine for a long period of time, you may notice that you get a headache. So even caffeine has withdrawal symptoms, and that's something that we all may drink at some point or time or drink daily. Withdrawal typically kicks in within 24 hours and can last several days, 2 weeks. And there's also something called PAWS, which is post-acute withdrawal symptoms. Those are slightly different than your immediate withdrawal symptoms, which are going to be more of your physical factors like that sickness feeling and stuff. But post-acute withdrawal symptoms are more of like those emotional or psychological withdrawal symptoms. And those can last anywhere from up to a year or two after you stop using the substance. That could be your anxiety, depression, different feelings that you may have because the drugs that you're using are changing and altering the chemicals in your brain. So that's kind of where that post-acute withdrawal symptoms come in. But the withdrawal symptoms that we just mentioned above tend to happen within 24 hours and can last several days, or maybe up to a week or two. The treatment of withdrawal symptoms might be different for different drugs. You could use another drug of the same class to treat the withdrawal symptoms. There used to be a list of different things that I would give my opiate users that would, like over-the-counter type stuff that you could use to treat like maybe your bellyache or your headache or, different things like that. So you could try over-the-counter type medications to help treat some of those withdrawal symptoms. Or, for opiates particularly, you're going to have, Suboxone, methadone, stuff like that. And also Vivitrol is another one that would treat, Vivitrol does not treat the withdrawal symptoms itself. You actually cannot have withdrawal symptoms and get Vivitrol, but it can prevent, those cravings with opiates. And actually, Vivitrol can actually be used for alcohol as well. They say you can prevent a hangover by drinking on a full stomach and drink lots of liquids and avoid heavier alcohol content drinks. I thought it was interesting that your textbook points that out. Only one drug causes addiction among a majority of users, and that's nicotine. So your cigarettes. A lot of people are addicted to cigarettes, and quitting cigarettes isn't an easy thing to do either. I've had clients tell me that, in comparison, it's very different than getting off of heroin, but the withdrawal and stuff like that from nicotine is actually almost as bad as getting off of heroin. And that's why I always encourage my clients, don't try to quit everything at one time, or you might set yourself up for failure. Blackouts. is the inability to recall events that happened when the person was drunk, even if they appeared normal during that time. Typically, your blackouts are going to occur when you have a BAC over 0.15. However, that may be different for different people, but that's a general rule of thumb for blackouts. We're going to move on to opiates. I know I touched a little bit upon that, but we're going to go into a little bit more detail. So your opiates, narcotics, are made from the opium poppy or similar synthetic drugs. 90% of the supply comes from Afghanistan. Stimulate increase of endorphins in the brain, which prevent the release of pain neurotransmitters. So there is a decreased sensation of pain, both physical and psychological. So a little bit different because we had our depressants that were kind of having that feel good, make us feel good pleasure center in our brain. The opiates and narcotics are actually decreasing our feeling of pain. So that might be another reason why people are more likely to use opiates, because they might have back pain or leg pain, arm pain, whatever pain, and they're going to take something that they think is going to reduce that pain, whether it be physical or psychological. Also, that's how people get addicted, by being prescribed pain pills from the doctor. All right, so with opiates, the tolerance is very strong when you build up a tolerance to it, and tolerance can be built up rather quickly with opiates. Withdrawal in users occurs only after a few hours of stopping using the drug, which would be your craving, muscle pain, restlessness, cold flashes, diarrhea, vomiting. And it's not as dangerous, as I mentioned before, as alcohol withdrawal. Oxycontin is another form of an opiate, like morphine. It's time release. Hydrocodone is used to treat moderate to severe pain. Oxycodone is about 50% more potent than hydrocodone, and it's a semi-synthetic opioid. Prescription drugs are most often misused by adults. However, kids can misuse prescription pills too. They might find it in mom and dad's medicine cabinet and take it to school with them, and give it to their friends or use it at school. Fentanyl has definitely, we've seen an increase in fentanyl cases, whether it be in heroin or fentanyl patches by itself. There is something else that I wanted to mention that is not in your textbook, but when I teach this course, I like to bring light to it, is another type of drug that I'm not sure if you've heard of or, are familiar with, and it's called crocodile. It's Krokodil, and you are more than welcome to Google that, but I will warn you that the pictures that you may see associated with crocodile are very graphic, and very gross pictures. So I'm not going to show you any of those, but if you chose to look them up, then you would see that. This drug surfaced around 2013 from Russia. That's where it was originated from, was in Russia. It's a homemade drug, so it's going to have a combination of different things. I think it's got lighter fluid, gasoline, paint thinner, alcohol, and other ingredients that kind of make up this crocodile stuff. And actually, it was a lot cheaper to make than heroin in Russia, so that's where this craze kind of started, and it's going to have similar effects to heroin, but a much worse after effect of heroin. It also, I'm sorry, I missed codeine in that list of things. So those ingredients doesn't really sound too appealing. It became popular in Russia in 2003, but it didn't really kind of come over here until 2013. It was cheaper to make this drug than to make heroin in mass production. And it got its name because crocodile is actually a Russian term for crocodile. And because of the list of ingredients that are actually used to make crocodile, it can turn your skin green and scaly. Crocodile. That's where you're getting that from. That's how it got its name. So where you inject this drug into your body, is where it tends to turn green and scaly. More than likely, it's because of the potent ingredients that are, you're not meant to ingest paint thinner or gasoline. It's eating your body from the inside out, and that's kind of how you're getting that green, scaly appearance to it. With continued use, it can literally rot your skin. People were actually putting parts of this crocodile stuff in heroin. If you Googled and looked that up, there were cases, I think there were 2 cases in Illinois that were in 2013 where women thought that they were getting heroin, but they actually got this crocodile stuff instead. I think the life expectancy too for people who would continue to use this is like 1 to 2 years after, the continued use of using this. So it's definitely a hard hitting drug. And the scary part about it is that it's being put into other drugs. We think that we're getting heroin, but we might actually be getting something else. Another scary factor of getting drugs on the street and not knowing what's being put in them, because your drug dealers are just looking to make money. That's their addiction. So they're putting these other things in the drugs that could be potentially harmful to you who's using them. Inhalants. They're also central nervous system depressants, can do permanent damage to your central nervous system and peripheral nervous system, can cause heart failure and death. With repeated inhalations, may feel drowsy for several hours and experience a lingering headache. An overdose can lead to a coma. Any type of solvent or aerosol, gasoline, paint, glue, lighter fluids, any of those things, that's going to be your high from that. And it's a very cheap, relatively cheap high. Mostly it's appealing to children and teens because, it's easily accessible. And, half these products you find around your house or find at school. Stimulants. They stimulate the central nervous system. So we got caffeine, nicotine, cocaine, methamphetamines. It increases your blood pressure, your pulse, dilates your pupils, might cause insomnia or loss of appetite. It might make you aggressive or violent behaviors. As far as cocaine, chewing leaves in South America to increase energy and kind of ward off hunger. So that's some of the purposes that people use the leaves in South America. They would soak and mash the leaves to make a paste and dried it into a white powder, and that's how you get your cocaine. If you cook it in water and ammonia and baking soda, you're going to get crack, which is a different version of it. It's a more concentrated version of it. It blocks dopamine transporter sites, so dopamine is not reaching the brain. The high from crack or cocaine lasts about 15 to 20 minutes, and then you're going to have a crash from it. So the high from crack is not as high or long. Oh my gosh, got it all twisted up today. It's not as long as if you were using cocaine. Got that out. It is highly addictive. Addicted rats will self-administer cocaine rather than eat or drink. Because of tolerance, the dose increases too. When people become addicted to cocaine or crack, the dopamine levels decrease, which results in depression, aggression, anxiety, and intense cravings. You can become paranoid and have auditory hallucinations. It causes the heart to beat inefficiently. That could cause heart damage, heart attack, strokes, or other respiratory failure. If it's combined with alcohol, it's even more potent and lethal. Effects on thinking can last at least a month after your use stops. Amphetamines and methamphetamines. So I'm going to break this down. Let's start with amphetamines. Amphetamines is synthetic drugs but has similar physiological effects of cocaine. In non-hyperactive people, they increase their adrenaline levels and suppress the appetite. Diet pills would be under the category of amphetamines. Ritalin is a prescription drug used to treat hyperactivity. It increases dopamine levels, enabling kids with ADHD to focus and filter out distractions, making decisions based on reason rather than emotion. And an interesting note that your book states that studies have found that kids who have been prescribed Ritalin over a long period of time are attracted to cocaine as a replacement drug when they get older because of the chemical similarity. So that's an interesting fact for you. The second category would be methamphetamines, so your meth or your crank. Usually available in powdered form, crystal meth, and can be snorted, injected, or smoked. And this high can be anywhere from 4 to 16 hours. When smoked, the meth high can last 8 to 24 hours. Nazis actually used meth to stay awake during World War II battles. Housewives in the 1950s used it to stay slim. It causes reduced levels of dopamine, which can result in uncontrollable shaking. The active ingredients are ephedrine and pseudoephedrine. Both are found in over-the-counter cold medications. So, a couple years ago when they put that, kind of law out there where you had to be 18 years old to buy some of those cold medications, this is why, because people were making meth with it. All right, nicotine. Nicotine is something we see every day. It's legal. We see it in the stores. We see it in the gas stations. It's highly toxic. It's going to stimulate the central nervous system. It comes from dried tobacco, the dried leaves of the tobacco plant. It is a natural insecticide. Dependence on nicotine resembles that of other drugs. There are compulsive patterns of use, craving, tolerance, and physical dependence. And nicotine actually harms nearly every organ in the body. Premature wrinkling of the skin, it reduces elasticity in your skin because of some of the 400 different chemicals that could be found in tobacco smoke. It damages the collagen and elastin and fibers in your skin. It elevates serotonin levels in the blood and the brain, which results in a calming effect. So if somebody's super stressed out, you may see them smoking a cigarette. That's where you're going to get that calming effect. It can stimulate or relax the user. Also people say that there's like a weight loss connection with it. Maybe not necessarily that you're losing weight by smoking cigarettes, but if you were to quit using cigarettes, you tend to gain weight back. It's doing something, metabolizing things different when you're, a repetitive smoker. Interesting. People with behavioral health disorders, 50 to 90% of them smoke cigarettes. So something that goes hand in hand is behavioral health and smoking cigarettes. If you drive by some treatment programs or providers, you might see a big group of people huddled outside smoking cigarettes. Smoking rates are declining in the United States, decreasing more than 50% between 1965 and 2009. And more males tend to smoke than females. 70% of smokers who want to quit and 40% will eventually quit. A craving takes 3 to 4 weeks to kind of subside, and your withdrawal from it are going to be anger, aggression, irritability, appetite changes, like I mentioned before, different things like that. And it's kind of interesting if you Google, quitting smoking timeline, there's actually a timeline that you can look at where even after so many hours, the different parts of your body that repair itself versus if you quit for months or you quit for years, and the way that your body can kind of heal itself after smoking. Very interesting. If that's something that you're interested in looking at, Google quitting smoking timetable or timeline, and you can look that up. E-cigarettes are becoming popular, or vapes. The health risks really aren't known with those because they're just becoming more popular. One of those drug trends, something that wasn't really there before is now becoming more popular now. It tends to be more attractive to kids due to the different flavorings. It's not really smoking. It's more acceptable by society. The flavorings that you're putting in these vapes or these e-cigarettes could be carcinogenic when they're inhaled. I know that doctors have told me before that, again, there's not a lot of research on it, but it could actually be putting fluid into your lungs, and that's something that really hasn't been studied yet. Smoking is highly correlated with alcohol dependence. 75% of those in alcohol treatment smoke. And vapes, people use the vapes or the e-cigarettes to try to wean themselves off of nicotine, that harm reduction, substituting one thing for another thing to try to, reduce yourself off of it. Chewing tobacco, snuff. 30 minutes of chewing, you get as much nicotine as 3 cigarettes. Males tend to be more likely to chew or use snuff than females, but females do use it also. But your risks are going to be cancer of your mouth and pancreas. And some of the other same effects of nicotine are going to affect you with the chewing tobacco as well. Hallucinogens, sensory illusions, tactile sensations, and altered sense of time. Hallucinations, insomnia, out-of-body experiences, and a trip that could last about 8 hours. LSD and PCP, you may have heard of those, angel dust. Both are synthetic drugs. PCP is an animal tranquilizer and anesthetic, and it lasts about 4 to 6 hours, can cause psychosis and violence, so you're taking a trip when you're using it. It's not an addictive drug, but tolerance can develop from using it. Peyote and mescaline. Peyote is a psychoactive plant dried to form a hard button that can be chewed or ingested in powder form, known to have been used for religious ceremonies in Mexico. Mescaline occurs naturally in the cactus. It is less potent than LSD. Psilocybin mushrooms grow wild in the world and produce an intense religious experience in many people and feelings of fear and paranoia in others. So they say, depending on what your mood is, before taking one of these mind-altering substances, could be what your trip is going to be like, whether it be a good trip or a bad trip. We've got your club drugs, known as your designer drugs. Ecstasy can produce both stimulant and psychedelic effects. It doesn't cause hallucinations, but it can increase sensory perception. So you may, like lights, how else could I describe this? Colors, things are going to be a little bit more, you're going to be more apt to seeing those things. So it's not necessarily a hallucination, but that sensory of seeing the colors or lights or different things like that may be more of a intense feeling than what it would be if, you or I were just looking at them. So MDMA is Molly. It's a designer drug originally developed as an appetite suppressant called ecstasy, both stimulant and in higher doses, psychedelic effects like speed and mescaline. It can come in tabs or capsules. It can cause heart and kidney failure. And it's not usually pure. It may be cut with other things like heroin or cocaine, or, unfortunately, it could be cut with rat poisoning or ibuprofen or any of those things. Also, MDMA or ecstasy is going to put holes in your brain. An interesting point that is come up a couple times in research is that, ecstasy is being tested to reduce the impact of trauma, like rape or battlefield trauma. So they're trying out different things with vets returning home, to see if it helps with like PTSD symptoms and different things like that. But I don't have enough knowledge on that research to really share anything else with you about that. But I have heard it a few times. Rohypnol, roofies, your date rape drug. It's a sedative like Valium, and it's used as an intoxicant. Amnesia of events, you're probably not going to remember things. Blackout. GHB is a bodybuilding drug with effects similar to ecstasy and sometimes used in connection with sexual assault. And then we have some of our newer synthetic drugs. Bath salts. You may have heard of bath salts. It's a man-made chemical synthetic drug. The thing with bath salts is that, it's made up of so many different types of chemicals that for a while there, when it was legal, it was because they kept changing one or two chemicals that, like the government couldn't keep up with, trying to shut it down and make it illegal because they kept changing one or two components of that chemical. Very dangerous. It can cause severe intoxication. Person may seem drunk or out of it, could become psychotic and lose touch with reality. We have spice and K2, synthetic marijuana, parts of the plants mixed up with different chemicals. It's kind of known as fake weed, but the effects can be very different than what marijuana effects could be. You might have more of like a psychedelic or hallucinogenic type effect from using spice or K2 versus if you were just using marijuana. Again, not guaranteed, but something when you're mixing different chemicals with the plants that could happen. Salvia is an herb that is smoked to give hallucinogenic effects. Cannabis, marijuana, effects are dose related. So low dose, it's going to act as a depressant. A high dose, it's going to act as a hallucinogen. Hashish resin from the flowering tops of the female plant tend to be more potent, and the THC is the active ingredient in that. Effects of cannabis are related products. Your feeling of relaxation, well-being, everything is funny. It activates brain cells that repress the urge to eat and activates those that increase appetite. So it stimulates the appetite, and things tend to maybe be more slow motion, that relaxed feeling. The cannabis is stored in fat cells, so it tends to be detected longer because it is stored in the fat cells. So when a person takes a drug test, it's going to be in your system for a lot longer than some of the other drugs that we've already talked about. There is no physical tolerance or withdrawal. I have had clients that I've worked with tell me that they have had some withdrawal effects from not using marijuana. So, again, maybe there's not enough research out there that proves that there are withdrawal symptoms from it, but I have had people had experience with withdrawal symptoms. However, your textbook says that there's no physical tolerance or withdrawal, and there's no risk of overdose with marijuana. I did mention in an earlier video that, those edible gummies that people were using out in Colorado or, different places like that where marijuana is legal for recreational purposes. sometimes when you're finding it in that, we're more likely to consume more than what our body can handle, but that isn't necessarily, classified as an overdose per se, but that is something where our body isn't able to handle it because we've consumed more than what it would be used to. Long-term effects of marijuana are not substantiated, may result in lower IQ scores or school performance in youth who regularly use it. Youth who regularly use are more prone to these impacts, but again, they're not clear. There's not a lot of research behind it. Marijuana could cause some cancer tumors to shrink through tumor cell death. Medical use varies. It could be used for PTSD, appetite enhancers for cancer patients, or an anticonvulsant. At this point, Pennsylvania doesn't have legal recreational use, but they're working on they have that medical marijuana use. So that's kind of where we are with that. At this point, I'm going to stop us there as we covered a lot of different drug categories and give you a lot of information. And this is one of our longer videos that we've had. And then we're going to pick up with talking a little bit more about how these drugs affect our body and how it metabolizes through our body. So stay tuned for Chapter 3 lecture video part 2. Thank you.